for like 12 hours. Lipid panel. Yeah, a lipid panel. Yeah, if they're doing a complete metabolic panel, they'll usually ask them to fast like for 8 hours just because of the blood sugar piece of it. But, no, lipid panel, they should be fasting for 12 hours. Your patient has infective endocarditis. What does that mean?
An infection.
They have an infection where?
In the endocarditis area.
In the inner lining of the heart, okay? And most often it has to do with the valves, because the endocardium lines the valves as well, okay? Because that's where bacteria and stuff going through gets hooked up on the valves and then causes an infection. Okay, so they have bacterial endocarditis, and they have been started on IV antibiotics. What do they need to know about those IV antibiotics?
The same as always, don't continue to take them. Oh, it's IV.
It's IV. That's right, it's IV.
Liar.
And they're gonna have to be on IV antibiotics for, once they leave the hospital, for another 4 to 6 weeks. They'll probably be on IV antibiotics at home. 4 to 6 weeks.
Still was right.
It depends on their insurance. For some reason, some insurance won't pay for it to be given at home. They have to go to a hospital to have it given, or they have to be like in a extended care facility where they can get it, and they have to be there until they're done with their IV antibiotics. Okay, your patient had a valve replacement. And, so what do they need to know about medication wise? Yeah, if they had a valve replacement with a mechanical valve, they will have to be on anticoagulants for the rest of their life. And when you're listening to a patient that has mitral valve regurgitation, what are you gonna hear? A murmur. A murmur. Okay, your patient has a medication for atherosclerosis. What do we need to assess them for that might be a contraindication for giving medications for their atherosclerosis?
What are the assessment for? What medications?
What kind of medications do we give for atherosclerosis?
What the? Statins.
I don't know.
Statins.
Oh, yeah.
Okay.
Just stop.
It's been a minute.
Okay, if they, atherosclerosis is caused by high cholesterol, and we give them statins for it, and so what do we need to assess them for? That's one of the things we teach them, that if they start having, muscle pains, they need to contact their healthcare provider right away, because they may need to have to go off of them, or at least change the type they're on, okay? But what we need to assess beforehand is their liver function. Yeah, is their liver function, because, statins, they reduce the cholesterol synthesis in the liver. And so if our liver is not working very well, that can be a problem. Okay, your patient, has, you're checking their radial pulses, and then their, brachial, their carotid, their femoral, their popliteal, their posterior tibial, pulses. Why are you checking all of those?
Check for perfusion. See if your heart's working.
Okay, so we're checking to blood flow, okay? So what would be another thing that we would be checking?
Circulation.
Circulation, and what would be the components for that? Besides checking pulses, we check for, the pulse and it's weakness, if it's, or whatever, but but what else?
If it's different.
Oh, because it's the same on each.
Okay, so yeah, we check and see if they're the same bilaterally. But besides pulses, what else do we check for circulation? Capillary refills. Skin temperature. Okay, now if they got cold feet, you know, they may always have cold feet, but if one of them's nice and warm and the other one's cold, that could be a problem. So as we're checking their pulses, we're checking for skin temperature as well. So that can give us a clue for their circulation there. Okay, your patient is hypertensive and they have a low potassium.
Hypertensive, right?
Yeah, they're hypertensive and they have low potassium levels. So in that whole renin-angiotensin, aldosterone system, which part of that could be responsible? The aldosterone. Okay, the aldosterone would be the part. So they have low serum potassium. They have too much aldosterone, then they hold on to sodium and water, and then,
All that sodium and water that causes decreasing potassium.
Okay, your patient has, had a cardiac cath, and you are doing your checks on them. What are we checking? Okay, so there's no blood on the dressing, but when you check the puncture site, what might you see?
Back.
Hematoma. Okay, that would be where there's still bleeding, but the skin has sealed, so it's not bleeding out on the dressing, it's just collecting underneath the skin.
So are we checking for hematomas or is
Yes.
hematomas normal?
Hematoma is wrong, we are
Oh.
checking to make sure that they don't have one.
Okay.
And if they do, then we would contact their provider, because that means that the artery has not sealed, even though the skin has. So we're checking for a hematoma. As well as checking, you know, to make sure that there's good circulation to whichever, you know, side the catheter was put, and, okay? You're listening to a bruit over your patient's carotid artery. And so, your patient's getting ready to go for a non-invasive diagnostic test. What kind of non-invasive diagnostic test do you think they might be going for? Ultrasound. Carotid ultrasound. Okay, good job, whoever shouted that out. Okay, so your patient, you think the patient is having a release of norepinephrine from the adrenal medulla. So what is it that would tell you that your patient is having this release of norepinephrine from the adrenal medulla?
Heart rate is speeded up.
Yep, your heart rate speeds up. Okay. And, okay, your patient has been treated for coronary artery disease, what are we teaching them dietary wise?
Lower cholesterol.
Yeah, low fat, low cholesterol, and low sodium. So particularly, I mean, if they lower their fat, they're probably gonna lower their cholesterol as well. So, lower saturated fat, some fats are good, so lower saturated fat and watch their sodium intake, and, they'll be pretty good. Okay, so, let's see, math-wise, that is a pretty standard math question here. This is what you have, this is what you need, how much you want to give. Here's a grains question.
What question?
A grains question.
Oh, what question?
Grains.
Oh, grains.
It's not a typo, I
60.
didn't mean to write grams, it says grains. Okay, that's basically addition, subtraction, and here's an IV drip one. Okay, you've got so much IV fluid to go over so long, and here's your drip factor on your tubing. So how many drops per minute are you going to give? Okay, so when you are looking at the process of atherosclerosis, the steps that atherosclerosis forms, okay, the first thing that happens is there's an injury to the vessel wall. Anytime we have an injury, then what does your body do? It causes an inflammatory process, right?
Yeah.
So we see an inflammatory process. During that inflammatory process, then we start seeing the low density lipoproteins getting trapped. Okay, so that's where we start seeing that formation there. And then we see oxidation. And that's after the low density lipoproteins have been trapped, then oxidation starts to occur. So first we have injury, then inflammation, and then the trapping, and then oxidation. I already told you gotta know where your valves in the circulation. Okay, you're caring for a patient to reduce the risk of developing heart failure. And so, what kind of assessment findings would tell you that you need to teach this patient about how to reduce their risks?
What finding?
Okay, so, what's a normal body mass area? Okay, so you would need to know that to know if the one in here is high, low, or okay. So know what the normal body mass area would be. And if it was too high, we were going to teach them how to lower it, right? If they're smoking, what are we going to teach them?
Quit.
Quit. If they are employed in, a factory,
Quit.
there's not a whole lot we can do about that, okay? We can't mess with that, so that's not something that, we do anything with. If they have an elevated blood pressure, we would need to teach them, how to get rid of that. And if they're elevated blood sugar, we would need to teach them as well, right? Those would all be risk factors. If their body mass area is too high, if they smoke, if their blood pressure is elevated, and if their blood sugars are elevated. So, risks for heart disease, age. okay, for modifiable risk factors versus non-modifiable. Is age modifiable or non-modifiable? Non. What about weight?
Yes.
That's modifiable. What about alcohol intake?
Yes.
Modifiable. What about your ethnic background?
No.
No. What about your parents' health history?
No.
Diabetes? Diabetes 1? No.
No.
Diabetes 2?
Yes.
Yes. What about smoking?
No.
Yes. Yes. Hypertension? Yes. Family history? No. Sedentary lifestyle?
Yes.
Okay.
Boom shakalaka.
Boom shakalaka laka. You know, I think it may be good to have the exam a little while after you have the information, because it makes you go back and look at it